Good morning, everybody. This is Dr. Sue. I wanted to talk just a few minutes about the baby formula shortage that we are currently in the midst of. What seems to be occurring is that we had a pretty major recall on a hypoallergenic formula that many families use, and maybe more than we even realized. It's for children that have cow's milk protein allergy, children that just can't tolerate regular milk-based formulas. But what happened is that we are seeing a significant decrease in the amount of formulas that are generally used, some of the more popular formulas, on the shelves at the store. What I do believe has occurred is that families were feeling very nervous about formula not being available, and so they tried to stockpile, almost like the toilet paper issue when COVID first started. So they stockpiled, and unfortunately, we are feeling the hit with the recall, with issues with getting commodities into our country with regard to COVID. We are seeing people stockpiling, and in the end, it just makes it really difficult for families to find the formulas that they may need. What I want you to do is this. I want you to make sure you talk to your pediatrician when you are having concerns about the baby formula. There are many, many formulas on the market, and some that are available on the store shelves that you may not be familiar with that will work just as well as the previous formula for your child. There are a variety of formulas that will be able to be substituted with regard to using formula for your children. In the case of special scenarios, such as hypoallergenic formulas like Alimentum and Nutramigen, even amino acid formulas, what I want you to do is make sure you talk to your pediatrician, talk to your GI doctors if they're the ones that have been recommending these kind of formulas too, because there are alternatives that we can try to help you get your hands on and go that route. And if your baby is 6 months or older, your pediatrician may tell you, let's try a milk-based formula, because milk protein allergy in babies can often resolve at 6 to 7 months. What I don't want you to do is start looking up recipes for baby formula. It is a very dangerous thing to be encouraging people to make their own formula. And I hesitate greatly to tell anybody to do so. Babies require specific electrolytes, specific calories. Any of the recipes that you may find could be written by anybody that's really not able to perform the studies needed to make sure we know what is in the formula once it's made. So please, I discourage you from looking into self-made baby formulas. There are also a milk bank that is a donor bank that moms that have excess milk can donate to. Remember, that is something you can consider as well, having breast milk instead of formula for your child. At the milk bank, you can ask if they have mothers that were dairy-free, mothers that limited their diet. You can get more information that way, and that milk is tested from the milk bank. If you get it from somebody else, it's not tested. I know that some wonderful moms are donating their breast milk to families needing formula as well. So just keep the lines of communication open. Know that milk is not tested. The milk bank is something that does exist that a lot of people don't know about. So just do your very best to find the products that work best for your child. Most importantly, communicate with your pediatrician. We know what's happening. We understand how hard this is. And we are here for you. We are also frustrated and trying to figure out solutions to help families. Every family is very different, and we understand that too. So please know that we are here for you. Thank you so much.